All right, the first mini lecture in this group of mini lectures is going to cover the childhood anxiety disorders. So anxiety is, to a degree, a normal and common part of childhood. But because children have had fewer experiences than adults, their world is often new and scary, and so they could be greatly affected by the issues that they face, and they could be very overwhelming for them. Surveys indicate that between 14 and 25% of all children and adolescents display some type of anxiety disorder. Although some of these disorders are very similar to their adult counterparts, more often they take on a somewhat different character due to the cognitive and other limitations of children. In terms of the difference between childhood and adult anxiety disorders, typically the anxiety disorders of young children are dominated by behavioral and somatic symptoms. They tend to center on specific, sometimes imaginary objects and events, and they are more often than not triggered by current events and situations. So let's talk a little bit about separation anxiety disorder. And there you see the very typical picture, or a very common picture of a child being dropped off at kindergarten or preschool on that very first day, and it's not going well. Separation anxiety disorder is one of the most common childhood anxiety disorders. Very often the children feel extreme anxiety, often panic, whenever they are separated from home or parent. A separation anxiety disorder may further take the form of a school phobia or school refusal, a common problem in which children fear going to school and often stay home for a long period. So what are the treatments for childhood anxiety disorders? Despite the high prevalence of these disorders, approximately 2/3 of anxious children go untreated. Among the children who do receive treatment, psychodynamic, behavioral, cognitive behavioral, family, and group therapies, separately or in combination, have been applied most often, each with some degree of success. Clinicians have also used drug therapy in some cases, often in combination with psychotherapy, but it has begun only recently to receive much research attention. And because children typically have difficulty recognizing and understanding their feelings and motives, many therapists, particularly the psychodynamic therapist, use play therapy as part of a treatment. So this mini lecture took a look at the childhood anxiety disorders. Next, we will take a look at childhood depressive and bipolar disorders.